This is Mayor Oliver Gilbert, and we've gone virtual. Now, I wanted to make sure that we had the opportunity to learn how to save a life while staying at home. Join me for CPR with Dr. Carrington. Let's learn how to save lives together.
Welcome back to Virtual CPR First Aid Educational Training. We hope you're enjoying the weekly sessions and that you're learning. Let's get to another session. In our last session, we learned how to use an EpiPen, and one of the signs of severe allergic reaction can be the signs of shock, but that is not the only time a victim can experience shock. Today, we will review what shock is and the signs that can occur when a victim is experiencing shock and what you should do. Although in the healthcare industry, we have several types and stages of shock, such as hypovolemic, when a person is experiencing a severe blood loss or fluid loss, making it hard for the heart to pump blood throughout the body. Today, we will cover how to react to a basic type of shock until emergency services arrives. Shock is a responsive condition to a stimulus which can be associated with a sudden fall in blood pressure, caused by such events as loss in blood, severe burns, bacterial infection, allergic reaction, or sudden emotional stress. Can a person experience shock by winning the lottery? Yes. Experiencing a death in the family? Sure. Shock can occur with any sudden, upsetting, or surprising event or experience. It is the way the body responds to extremes, one or the other. How do you know when a person is in shock? According to American Heart Association, we should look for these signs and symptoms: dizziness, agitated or restless, confused, feeling faint, cool or clammy skin, pale skin, bluish lips or fingernails. For darker skin, it could appear gray, rapid breathing, enlarged pupils, or weakness or fatigue. What you should do: phone emergency services or call 911. Get a first aid kit. Follow the instructions of the emergency dispatcher. Remove the shock stimulus if possible. Stop the bleeding with compression and pressure. Cover the patient with a blanket or foil blanket that is in the first aid kit that regulates the temperature. The person can become unresponsive or only gasp for air. At this time, you would perform hands-only CPR or traditional CPR using mouth-to-mouth or mouth-to-mask sequence until fire rescue arrives on the scene. Look at this video clip courtesy of American Heart Association.
She got hit by a car.
Shock develops when there is not enough blood flowing to the most important parts of the body.
On either side. Has anybody got a cell phone?
A victim in shock may feel weak, faint, or dizzy, have pale or grayish skin, act restless, agitated, or confused, be cold and clammy to the touch.
Now, how are you feeling?
My stomach's starting to hurt real bad. The car hit me right here, and I feel real dizzy and kind of cold.
First, make sure the scene is safe for you and the victim. Phone for help. Help the victim lie on his or her back. If there is no hip or leg injury or pain, raise the victim's legs about 12 inches and rest them on something like a box or rolled up coat. Use pressure and gauze to stop any bleeding you can see. And cover the victim with a blanket to keep them warm.
I'm going to raise your legs a little. Would you open this silver blanket for me, please? Are your legs hurt?
No.
All right, I'm going to raise your legs, and you let me know if it hurts when I do.
Okay.
Lift her legs while I do. Thank you. Okay, are you all right, Frida?
Yeah.
All right, now we're going to put a blanket over you, and this will help keep you warm. Just tuck it in down by her feet. Let's get it all the way up around her shoulder.
This is what the steps of shock management look like when they're put together. First, make sure the scene is safe for you and the victim.
Okay, the scene is safe. I'm cold, weak, and dizzy.
Phone for help.
You, phone for help.
Help the victim lie on his or her back. If there is no hip or leg injury or pain, raise the victim's legs about 12 inches and rest them on something like a box or rolled up coat. Use pressure and gauze to stop any bleeding you can see. And cover the victim with a blanket to keep them warm.
So now you will know what to do to help save a life when a person is experiencing shock, as some shock emergencies can be fatal. Thank you for watching. Remember, everyone can learn to save a life. See you next week for more educational training on first aid and CPR.
I hope you enjoyed today's session and I hope you learned a lot. Join us every Saturday at 10 o'clock a.m. on Facebook Live for CPR with Dr. Carrington. If you want to view this session again, just to brush up on your skills, visit cmgengage.com/virtual. We'll see you next week.